Mr. Sugar.
Hello.
My name's Jeanette. I'm going to be a nurse with you today.
Okay.
This is my student nurse, Carly. Is it okay if we do an assessment and if she observes me
Sure.
doing that? Okay. Let me go ahead and wash my hands before we get started. How's your day been?
It's going well.
Good. Any plans after you get out of here today?
There's really not much. Just probably go up to the mountains later on the day.
Oh, good. Good for you. May I go ahead and check your armband? Can you tell me your name?
Dave Sugar, 6/29/57.
Okay, very good. Can you tell me where you are today?
Well, yeah, I am at Sky Ridge
Okay, what's the date?
and the 10th of November.
Okay. And can you tell me why you're here today?
I'm here for a knee surgery for my right knee.
Okay. So a total knee surgery?
Correct.
Okay. So I'm just going to review kind of your health history that you put on this paper before I do your physical assessment.
Okay.
Then we'll get your vital signs. I just want to do a scene surveillance that your bed is in a low position. Your belongings are in a bag out in the where we keep them. Do you feel unsafe at all?
Not at all.
Okay. So it looks like you're married. You were a store clerk. Did you do a lot of standing?
I did a lot of standing, a lot of moving, a lot of walking around.
Okay. But it looks like you do have an exercise routine that you lift weights 5 days a week.
I did up until my knee problems. I did 5 days a week.
Okay. When did you stop doing 5 days a week?
Probably within the last few months.
Okay. Have you ever smoked?
Never.
Okay, and here it says you have an advanced directive and living well.
Correct.
It says you drink coffee 7 days a week. Is it 1 or 2 cups?
One maybe, and it's not always 7 days, but I try to cut down on the caffeine for the most part.
Okay. You live with your son, who is 16 years old, your wife,
Correct.
and you have no pets, and you live in a house.
Correct.
Okay. Are you under a lot of pressure at work?
No, not the average. Not really.
Are you allergic to anything? All right. And it looks like medications you're on are just a multivitamin and omeprazole.
Correct.
What do you take the omeprazole for?
For occasional heart.
Okay. And when you put digestive disorder, is that what?
Yeah.
Do you have anything else?
No.
Okay. And bone or joint disease, is
No.
it just with your knee?
Just the knee problem.
Okay. And it says you've had a couple surgeries, a knee and a wrist. Can you tell me about your knee surgery that you had?
It was basically the arthroscopic surgery for the knee a few years ago, and then I had a little bit of a wrist situation.
What did they find for your knee going on with you?
They really didn't find any. They did arthroscopic surgery on it, and applied for a little bit of ligaments, maybe tendons. I'm not sure what it was. And it's just been fine pretty much since.
Okay, and how about your wrist surgery? What was that for?
They probably thought it was a ganglion.
Okay. Your family medical history, it looks like your dad had colon cancer.
Correct.
Okay. When's the last time you had a colonoscopy?
It was probably about 4 years ago.
Okay, and do you keep on top of
Every
them?
5 years.
Okay.
Yes.
And he died of lymphoma.
Correct.
Okay. And I see everybody else is in good health. You had a brother die of pancreatic cancer.
Yes.
Okay.
2 years ago.
Okay. Looks like you're 185 pounds, and we weighed you in the hallway before you came in just to verify. Okay. Your health history is pretty much negative, except for we talked about the heartburn. Otherwise, you said you're in good health.
Great health, I think.
Okay. Joint pain, joint stiffness, which we'd expect if we're doing this, and difficulty walking. Are you in any pain today?
No, not for the most part. I'm really not. Just when I stand on it a lot, or if I do a lot of heavy lifting or lifting, sometimes I feel it.
Does it ever get swollen? You're on it a lot.
Yeah, occasionally, and then I'll just kind of elevate it or sometimes ice it. Not too,
Does that help it?
It does.
Okay. Do you drink alcohol?
Occasionally, not
Okay. And it says you've never felt a need for other drugs. Your personal safety, you feel safe at home. It's pretty much a negative history. Do you have anything else you want to tell me before we get started with the physical exam?
very often. Not that I can think of.
Okay. So I'm going to take your blood pressure and your heart rate and your oxygen saturation, and then when I do your respiratory exam, I'll go ahead and do your respiratory rate and listen to your heartbeat at that time. I don't want to get any of the gown in here. This gets really tight the first time. Okay. It's just a temperature. Very good. 97.9. Okay, your blood pressure is 111 over 73. And your heart rate is 82, with your oxygen sat being 96. So everything looks good.
I'm good.
I'll go ahead and palpate your .84. Very good. Okay, I'm going to kind of start at your head and work down your body. Okay, so I'll tell you everything I'm doing as I go.
Okay.
I'm going to get on some gloves. Okay. So I'm going to take a look around your head. Look and see if there's any lesions, which I don't see any. I'm going to part your hair. It's it's in good condition. Semi-balding. No lesions noted. Do you have any tenderness?
No.
Okay. I don't feel any lesions, any bumps, no tenderness. Okay. While I'm here, can you open and close? Okay. No crepitus fell. Does that hurt?
Not at all.
Okay. That was checking for your TMJ, what they call your muscle to see, or your jaw to see if you have any issues. Because they'll want to open your mouth when they put the tube down when you do surgery. So we check for that. I'm going to just check your ears. See no lesions. You have no pain, correct?
Nothing.
Okay. Have you always had this mole
On
behind
the back. Yeah, it's been there.
you? Okay. Has a doctor ever looked at it?
Yeah, and it's always been fine.
Okay.
Nothing made of it.
I'm going to go ahead and look in your ears. And this is looking at the tympanomastoid. So it's grayish, not bulging, silvery, looks normal. I see no lesions. There's no wax. Go ahead and check your other side. Okay, got a little bit of wax on this side, but not a whole lot. Tympanomastoid looks really good on this side, grayish silver in color. So now I'm going to go ahead and take a look at your eyes and mouth in a minute here. I'm just going to in your eyes. Can you look down? Look up. Look up. Look good. No protrusion. No crustiness. Okay. I'm going to go ahead and look in your mouth. And I'm sorry. Okay. Uvula is on midline. It's nice and pink and moist. The teeth are, looks like you got your wisdom teeth out.
I have.
Okay. No dental caries, no halitosis. Can you stick your tongue out and open wide? So you've had your tonsils out.
Uh-huh.
Okay. Sorry. I always ask you questions when I. Okay. I'm going to check up your nose. Okay. Turbinates are nice and moist, no drainage, no crusting, no nasal flaring. The septum is the midline with no holes in it. Okay, I'm just going to palpate. This is the frontal sinus. Do you have any pressure here?
No.
This is the maxillary sinus. How about pressure there?
Nothing.
Okay. Now I'm going to do your lymph nodes. So I'm going to be pressing. We're going to go behind the ears, in front of the ears, and kind of down the throat. Okay. So these are postauricular. Feel anything?
Nothing.
In front of the ear? Nothing. We're going to move down the neck. Posterior. Anterior. These are your tonsillar. Your submandibular. I don't feel any in your submental. Here, these are your clavicular. And I don't feel any nodes at all.
Oh, good.
Okay. He has facial hair, no alopecia noted. You're warm. Skin is within normal limits for your ethnicity. Do you have any questions so far?
No, not so far.
Okay.
Everything felt